Hello, my friends in Utah, and welcome to your annual session for the Utah Dental Hygienists Association. I was really excited when some of your leaders reached out and asked if I would bring you greetings for this exciting time and this exciting meeting. My name is Matt Crepsin, and I am the current president of the American Dental Hygienists Association, and it's really an honor and a privilege to serve in that role, and I'm really excited to share a couple of thoughts with you this morning as you kick off your weekend, and I wish you a very productive and excellent meeting that I hope you'll have. I want to first, of course, recognize the fact that in your state, you have some amazing leaders. Your current president, Jessica Atkinson, I know is an amazing leader and has really done a tremendous job this year, and you have a host of leaders in your state that are really doing some amazing things. In fact, another great leader you have is Danielle Evans, who will be attending Unleashing Your Potential this year in just a couple of weeks in November, which is a leadership development program that ADHA offers to about 24 leaders that are selected amongst a very large pool of applicants who are looking to engage and enhance their leadership capabilities to potentially lead not just at the state level better, but in potentially at the national level. We're doing a lot of really exciting things at ADHA right now, some of which I'm sure you've heard about. We have this amazing partnership with Walgreens and the Listerine brand through Johnson & Johnson that's currently kicked off for National Dental Hygiene Month. You can go to our website, the National Dental Hygiene Month website, find a participating Walgreens, head there, you'll see a display that is displayed in almost 6,000 Walgreens stores across the country. Walgreens is the 6th largest retailer in the country, and it's really telling the story of why dental hygienists are important. We're a valued member of the oral health community, we're prevention specialists, and patients listen to us. We make recommendations to patients on a daily basis, and that's what Walgreens and J&J have entrusted in us, that we will not only recommend a great product like Listerine, but we'll recommend that people go and buy it at Walgreens, who's invested in our profession and more specifically our association as a vested partner. So this is something we're really, really excited about. It's the first of its kind partnership, and we're already in discussions about phase 2 and phase 3 and what that might look like. And I'm really, really excited about things that are starting to shape up that you'll hear more about in the coming months and years. A couple of things that I would just invite you to engage in. One, of course, the social media campaign around the Do the Swish campaign. Post your picture at Walgreens, use the hashtag Do the Swish. Please engage with me on social media. If there's things that come up throughout the year and you have questions about, feel free to reach out to me on social media. Send me an email. My email address is mattc@adha.net. And I'd be happy to answer your email or engage in a conversation with you. I'm always open to that, to hearing from both members and potential members. I'm really wanting to hear back from you on how you think things are going and input that you might have just in general about our profession and more specifically, of course, about ADHA. I want to talk really quickly about a couple of different things. Just really engage you all in becoming active in your association. And being active can range from attending this meeting, which you're doing today, to reading emails that come from your leadership, to serving in a leadership position on a council or a committee at the local level, at the state level, or at the national level. Each of those small parts, which there are no small parts, but each of those parts really contributes to the greater good of the whole. And each one of you plays an important role in that, so I would encourage you to find what way makes most sense for you to engage in that. You all have some important work that you're heading into this year. You're working on legislation that would allow dental hygienists to become Medicaid providers and be directly reimbursed for services that they provide. My guess is that in many cases, those services are already being provided in your state, and dental hygienists aren't currently being reimbursed for that. Only 19 other states allow for that, so hopefully you guys will become the 20th state. I know in my own home state of Wisconsin, I was very involved about 12 years ago when we passed this legislation to allow dental hygienists to become Medicaid providers, and since we've seen a huge influx of providers that are providing care in a whole range of different places. Places like now physicians' offices and schools and public health departments and nursing homes. And all being able to do it in a really sustainable way because they're able to be reimbursed for those services from the Medicaid department. So I wish you the best of luck on this, but it's really important for each one of you to get engaged, to call your legislator. Your legislator should view you as a resource when it comes to oral health information. Anytime that a legislator sees information come across their desk that pertains to oral health and more specifically dental hygiene, they should think of picking up the phone and calling you. So reach out to your legislator, introduce yourself, meet them when they're in your district, visit them at the State House. They want to get to know you. They want to hear from you because you elect them. And I personally have developed great relationships with my elected officials. And I can call on them when I do have an opinion or I want them to think about things a little bit differently. So this is a really important way that each of you can get engaged. Along those same lines, it's really important to understand that ADHA, and in your state, the Utah Dental Hygienists Association, which is one of our state constituents, we are the only professional association that has the best interests of dental hygienists as our #1 priority. You might be approached by other associations, public health associations, mobile dental group associations, dental associations, other dental hygiene groups that will try to engage you as members. But it's really important to know that their #1 priority may not be advancing the dental hygiene profession. And I can assure you that the Dental Association's #1 priority is not advancing the dental hygiene profession. It's to advance the dental profession. Just like our #1 priority is to advance the profession of dental hygiene. So what I'm trying to impart in you is make sure you're members of your professional association. If you're not a member of the Utah Dental Hygienists Association and ADHA, I would really encourage you to consider that. And those of you that are members, I really, really thank you for your dedication to that and your commitment to that. And I hope that you'll continue to be members in years to come, because this group of people, the leaders that you see before you in your state, they are the ones that are making push for change. And they are the ones that are keeping your profession, your practice, your scope, #1 first in mind and as a priority. So it's really important to keep that in mind. I know that there's a lot going on in your state when it comes to that. So I would really, really encourage you to engage and invest your time and energy with the association that has you as the #1 priority, which is your Dental Hygienists Association, both at the ADHA and at the state level in Utah. Just really quickly before I wrap up, we're doing some other really exciting work at ADHA on dental testing. We're part of a coalition that's pushing for the elimination of the single encounter patient-based exam. The House of Delegates passed a policy a couple of years ago to support that, and we've now been engaged in a coalition that includes the ADA, ADHA, and the American Student Dental Association that's looking at elimination of single encounter patient-based exams. And we're also engaged with the same group around improving the portability of licensure, so that if you were to ever move from Utah to another state, you would have a much easier time of being able to get your license ported from one state to the next. Those of you that live in your state that have moved from another state might be able to share a story about how difficult and challenging that can be. So that's another area that ADHA is working on. As I said at the beginning, we're doing a lot of really exciting things. My focus this year has been on the concept of Imagine, and really trying to help our board and our members and people like you think in a way that's thinking up and out, and thinking about and imagining all of the different possibilities that we have for the future of our dental hygiene profession. It's a really, really exciting time to be a dental hygienist. It's a very exciting time for me, and a huge honor to be leading the association in this time. And again, I thank you, those of you in the room that are members, and I would implore you and engage each one of you that's not, to really give some consideration to becoming a member and being part of this movement that is very exciting. And I wish you the best of luck, and I hope you have a great meeting. And I look forward to hearing from you. So please send me a message. I love hearing from people from around the country. And again, I thank your leaders for the dedication that they give to this association. and for the work that they've done this past year. So thank you and have a great meeting.